Welcome to the in-service on trauma transfer within long-term care and assisted living at the Woodland Incorporated. Today, the objectives of this in-service are: what is transfer trauma, reaction categories, common symptoms of transfer trauma within the three categories: 1, mood; 2, behavioral; 3, physiological. What are major causes of transfer trauma? When can residents experience transfer trauma? Who is at higher risk to experience transfer trauma? Ways to prevent and minimize transfer trauma, and how long can a resident suffer from transfer trauma? According to Tracy Green Mintz, a nationally recognized expert in relocation stress syndrome, transfer trauma is defined as a cluster of symptoms that can occur in anyone who moves from one environment to another on their own free will or under circumstances they cannot control. Symptoms of transfer trauma can be categorized into three categories of reactions: 1, mood; 2, behavior; 3, physiological symptoms. Common symptoms within the three reaction categories include: mood, feeling sad, feeling angry, irritable, depressed, anxious, and tearful. Behavioral: combativeness, screaming, complaining, general challenging behaviors including wandering, shut down, withdraw, refuse care, isolate themselves, and refuse to take medications. Physiological includes confusion, pain, falling, rapid heartbeat due to anxiety, sleeplessness, poor appetite, weight loss or gain, drug seeking, sudden onset of irritable bowel syndrome, indigestion or nausea, increased coping through a bad habit like drinking and smoking. Major causes of transfer trauma include an experienced loss in one or all of the following: physical loss, loss of social contacts, loss of familiar roles, loss of financial security, loss of independence, loss of power, loss of mental stability, and loss of dreams. When can a resident experience transfer trauma? Anytime they move from their personal home setting to assisted living communities, anytime they move from their personal home setting to a long-term care nursing home setting, anytime they move from their personal home setting to live with a family member, for example, a child, moving from one level of care to another, for example, moving from assisted living to long-term care nursing home or skilled rehab, moving from one room to another room within the same unit, and being transferred to the hospital. Who is at higher risk of experiencing transfer trauma? Individuals with Alzheimer's or dementia who cannot participate in decision-making and have difficulty assimilating new information. This includes residents that suffer from Alzheimer's, dementia, have an increased struggle with the fear of loss of control, choice, and the lack of the familiar surroundings. Some struggle with accepting they are not able to live alone and take care of the day-to-day activities by themselves, making a move to a new location more stressful, as seen in behaviorals expressed. The degree of dementia experienced by the resident will have an effect on how they respond regarding what level of transfer trauma they experience and how soon it resolves. Residents that are in agreement with the move for whatever reason tend to respond better, but can still experience different levels of transfer trauma, but normally do not experience symptoms for as long or as severe. Ways to prevent or minimize transfer trauma for residents. The number one way to prevent or minimize transfer trauma is to try and get the resident to be on board with the decision to make the move and why it is needed, and then allow them to be part of the final decision and throughout the process. Ensure it is a needed transfer and not for convenience of others like family members. Make sure the new facility is as good of a fit for the person as possible and the appropriate level of care that is needed for that individual. For example, assisted living versus long-term care nursing homes. Allow them the opportunity to ask questions and discuss their concerns. Try to maintain their daily routine as much as possible. Safeguarding their personal possessions. Allowing them to help set up and decorate their new room or apartment to their liking. Allowing them to bring in items from their personal home so that it resembles home as much as possible. Helping them to become acclimated to their new surroundings. And actively listening to their concerns and try to promote a feeling of security and comfort. How long can a resident experience transfer trauma? There is no set time frame that an individual may suffer from transfer trauma. It can be from days to months, maybe even longer. Each individual reacts different and there is no set time frame. As members of the staff here at the Woodland Incorporated, we have to try and create an environment that is welcoming and supportive. This allows the new resident to feel safer and hopefully will suffer from transfer trauma for a shorter period of time. Points to remember. Transfer trauma is defined as a cluster of symptoms that can occur in anyone who moves from one environment to another on their own will or under circumstances they cannot control. Transfer trauma is different for every individual. There is no set response. Create a welcoming environment that makes the resident feel comfortable, and he or she will want to be a part of more activities, which will have a positive response in accepting the change easier. There are three categories of reactions to transfer trauma: mood, behavioral, and physiological. Different levels of loss can be contributing factors to a resident experiencing transfer trauma. Transfer trauma can be the result of a move as simple as from one room to another, to that of moving from a private residence to that of an assisted living of long-term care or nursing home. Individuals suffering from Alzheimer's dementia are at a higher risk of experiencing transfer trauma due to their inability to process and reason why they are unable to take care of themselves at home. There are many things we can do to try and minimize the degree of transfer trauma, with the number one thing being trying to get the resident to be on board with the move and allowing them to take part in the decisions to the best of their cognitive ability. Try to make their new environment as comfortable as possible, allowing them to bring in items from their home to create an area as close as possible to help minimize the change. One of the most important points to remember: change is part of life and no one likes it at any age, but it is a part of life. Keep this in mind when you are caring for a resident. Their lives have changed for many different reasons, need it be physically, emotionally, or by choice. Be supportive of their time dealing and coping with the change within their lives. I leave you with this quote by Johann Wolfgang von Goethe. Life belongs to the living, and he who lives must be prepared for change. How we care for our residents during these changes is what sets us apart from other facilities. Be supportive and show our residents that they are cared about and we want them to feel part of the Woodland family. Thank you for attending this in-service, and remember, change is hard for everyone. Please be supportive of our residents as they go through transfer trauma, and remember, it's different for everybody. Thank you.